Order. Order. I call Dr. Simon Ofer to move the motion.
Thank you, Chair, and it's a privilege to serve under your chairmanship, and thank you, Minister, for attending. I'd also like to thank the Backbench Business Committee and their co-signatures for my application, and I'd like to place on record my thanks to MSF UK and also Professor Ramsey Khamis for their assistance in preparation for today. So, this debate could not have come at a more crucial time, actually, for healthcare in Gaza. In about a week's time, many aid agencies who provide medical care are going to be barred from operating in Gaza. And I believe there's going to be an urgent question to the Secretary of State, the Foreign Secretary, today about this very situation. So this is a very live debate, and I'd like to thank all the speakers for putting down to say something about this really crucial issue. In June of last year, I was preparing to go to the Chamber for Foreign Office oral questions, and I received a phone call from my colleague, Dr. Rebecca Inglis, who works for Healthcare Workers Watch. She told me that just hours before that, a GP in Gaza was killed by an Israeli soldier shot in the head. And I don't know why. I think it may have been because I'm also a GP, but this really hit home to me, the situation that was happening in Gaza. And actually, over 1,000 healthcare workers are now being murdered in Gaza, while countless others remain detained. So, talking about the healthcare system in Gaza, I'd also like to talk about healthicide as a concept. The deliberate targeting of healthcare workers is becoming an instrument of war, not just in Gaza, but in other places in the world. Now, healthcare workers, they don't have sides. They're not partisan. The only side that they're on is on the side of humanity. And we must stop this developing situation in the world. And in addition, the healthcare system in Gaza after this targeting is near total collapse. And as I say, in a week's time, many aid agencies, over 30 of them, are going to be barred from working in Gaza. So I'd like to take both those issues and discuss them. The targeting of healthcare workers in Gaza has been widespread and well documented. Since October 23, 1,700 healthcare workers have been killed, hospitals have been bombed and raided, senior doctors have been detained. And in fact, I talked to one healthcare worker in Gaza, and they said they couldn't leave the hospital in scrubs because they would be identified as a healthcare worker and arrested. Later this evening, I'll be hosting a launch event for the investigation into the Gaza aid worker massacre on the 23rd of March, when 15 emergency workers were massacred by Israeli forces. And also, I couldn't come to this debate without mentioning the tragic case of Hind Rajab, a 5-year-old Palestinian girl murdered by Israeli forces alongside 6 of her family members. And crucially, 2 paramedics who were coming to save her life were also killed. So her voice will continue to haunt the world. And I'm hoping later on today to meet her mother, and I want to be able to look her in the eye and say, this government is doing all it can to prevent another situation happening like happened to her daughter. So healthicide is becoming a new phenomenon in war. In Syria, for example, healthcare workers were systematically targeted by the then Syrian government and Russian forces over 13 years ago. And the same is happening in Sudan. So there's a bigger point. We must stop this happening. And this is something I think this country should campaign upon in the world. So the current situation in Gaza, as I say, is quite grim for healthcare. There's not a single hospital that's fully functional in the Gaza Strip, while 50% of them are partially functional. Among primary healthcare centres, there's only 1.5% that are fully functional, 3 out of 200. There's not a single operating hospital in northern Gaza or in Rafah. Healthcare workers are conducting over 100 consultations a day. In British general practice, I'm not allowed to do more than 25, so it gives you a feeling of how much work these people are doing, and that's putting an enormous strain on the healthcare system. There was an interim rapid damage and needs assessment conducted jointly by the United Nations, the EU and the World Bank, and it found that there had been more than £1.47 billion of damages inflicted on the health sector, and recovery and reconstruction will cost about £8 billion. So there's a massive need to rebuild the healthcare facilities in Gaza. 2 weeks ago, I also heard direct testimony from a British doctor who's just returned from Gaza. And she actually witnessed the willful destruction of medical equipment, for example, cutting off the end of all the ultrasound machines and the systematic destruction of medical data. She described seeing patients arriving with sniper wounds that were so precise that they were clearly made to cause disabilities that would be lifelong and therefore harm young people in Gaza. For example, I saw... I will give way.
I thank him for giving way, and like me, many residents across the Filton and Bradley Stoke constituency have been horrified to see the scale of human suffering on the ground in Gaza. And it's right that our government has been doing what it can to bring children in urgent medical need to the UK for treatment. Now, would he agree with me that it's vital that our government continues to do all that it can to help vulnerable children in Gaza?
Yes, can I thank my honourable friend? And indeed, the medical evacuation of young people is something that many of us campaigned upon and which the Minister did deliver, although there are certain problems which I understand he may go into recently. I think also, I'll come back to this a little bit later, one of the key issues in Gaza is that it's allowed to medically evacuate everyone, to East Jerusalem, which is still in the occupied territories, but at the moment that's not allowed. And East Jerusalem has some well-functioning hospitals with capacity, and I do think this is one of the asks that we need to do. So can I thank her for her intervention?
Allow me on young people.
Certainly, yes.
I'm very grateful to the honourable member for giving way. He's talking very passionately about the impact of the physical injuries to young people, but we know that trauma recovery for children and young people will have to be a vital part of the long-term solution for Gaza. And the International Centre for Child Trauma, Prevent and Recovery has pioneered a capacity-building model of training to put as many counsellors on the ground as possible. And I engaged with their co-director at a fundraising event in Ceres in my North East Fife constituency. Does he agree with me that when the UK government is looking at how it funds and supports, it needs to look at trauma recovery too?
Okay, yes. Well, can I thank the honourable member for her intervention? And I absolutely agree. And war is traumatic on so many different levels. And I think that mental health is a key part of holistic care and must be covered in any sort of rebuilding of healthcare workers. And also we need to start to look at training people in the Gaza Strip and in the occupied territories as well, because it's better to train them rather than import them. So, yes, I certainly will.
He quite rightly makes a passionate case for why we should be doing more to help the healthcare system in Gaza. It's quite clear that the 50 children that were severely ill from Gaza that were evacuated by this government and treated in NHS hospitals were well cared for. Indeed, the Prince of Wales visited some of them in hospital and said explicitly afterwards they'd faced experiences no child should ever have to face. But does he agree with me that the next step this government should be taking is to treat, as he suggests, those children in the region, and that there's plenty of British medics who are willing to help and go out there, and we should be, as a government, encouraging them to use their NHS expertise to treat children in region, but also to train up medics in specialisms that they desperately need.
Yeah. Well, can I thank my honourable friend? I think he's absolutely spot on. I do think we, rather than evacuating children to the NHS, which was, I think, the right thing to do at the time while war was raging, it's actually better to build up facilities in the area and start training doctors and also other health professionals to look after people in the area. I know we are training some Gazan medical students who I've met, but I do think the future lies in building up medical training in those areas. So,
give way on that point.
Certainly, yeah.
I'm really grateful to my honourable friend securing this debate, but also the very pertinent points he's making. Does he agree that the Minister should therefore work with the Health Secretary to ensure that clinicians of all kinds are able to get the release they need in order to spend the appropriate amount of time in the region in order to provide that training and clinical support?
Yes, can I thank my honourable friend for that very timely intervention? I know her professional skills are also something that she uses in Parliament, and I think it is really important that we support the healthcare system in Gaza, and I know that the Foreign Office is very keen to do this. So yes, there has been certainly, yes, yeah.
To the honourable member for giving way and strongly support the points he's raising in advancing this case. I'm just slightly worried about the expression in the region. What we need to do is to get medical workers into Gaza and to make sure that they can safely deploy their skills within that area. We're long past the time when the Israeli regime could justify their actions in terms of self-defense. And the best way of achieving safe passage for medical aid workers in that area is to get the IDF out and to get international peacekeepers in.
Well, can I thank my honourable friend, and I think he's absolutely spot on. I mean, actually, the most important thing is peace, so we can actually build a healthcare system. And although there has been a ceasefire, there's still quite a lot of Palestinians are still dying, and that's something we need to make a stable environment first. But I totally agree with you. I think we have to be pragmatic, and I think that while there is functioning hospitals in East Jerusalem, we should be able to take people out of Gaza and get them treated there. The healthcare, as I've just outlined, the healthcare facilities in Gaza have been very, certainly very damaged. And I will come on later to some possibilities of bringing mobile units in on a short-term basis. I think, obviously, long-term, we need to build up the hospital sector. Yes, certainly.
I thank my honourable friend for securing this debate and giving way. I was reading that Gaza is now the home to the largest number of child amputees, and yet Save the Children are saying the prosthetic centres in Gaza are just not functioning. Would he agree that Israel now needs to lift all restrictions on aid getting into Gaza so these young people can get the prosthetic limbs that they absolutely vitally need for day-to-day life?
Can I thank my honourable friend? A point really well made, and I think actually, it comes even more basic than that. We need to allow medicines into Gaza. At the moment, medicines aren't being transported in there, and obviously other things like prosthetic limbs are very, very important as well. So, yeah, absolutely, we need to open up the border. And actually, we also need to bring humanitarian aid, not just medical aid, into Gaza. So it's certainly, I think we need to open up the borders and allow relief into Gaza. So thank you for that intervention. I was just going back to my speech. There seems to be a slightly sinister thing going on where snipers are actually targeting very specific areas. So one area is the brachial plexus. That causes long-term disability. And another area is in the leg, hitting the sciatic nerve. And that also causes permanent paralysis and disability. And that's I think, a cynical approach to war. I know war is evil in many of its aspects, but this is particularly something that we should call out as well. Can I just say a little something about public health, Mr. Chair? So public health is incredibly important for the people in Gaza Strip. 89% of water, sanitation and hygiene infrastructure has been destroyed or damaged. And that's probably one of the most important things we do, get clean water to people. There's about 250,000 cases of acute malnutrition in children this year, as well as 37,000 cases in pregnancy and breastfeeding women. There's violence against women and reproductive health has led to 41% fall in births in Gaza, as well as a high number of maternal deaths and miscarriages and newborn mortality. And we've seen strikes on maternity wards and also the destruction of Gaza's largest IVF clinic, wiping out 5,000 embryos. So premature births have also sharply increased, with 1 in 5 newborns requiring intensive neonatal care, and respiratory infections, acute watery diarrhoea and skin infections are widespread. And at least, this is a horrifying statistic, I think, Mr. Chair. 11 children have reportedly died from hypothermia this winter, including a 2-month-old baby and a 1-year-old child. So there's so many serious problems. One other I'd like to pinpoint as well is a syndrome called Guillain-Barré syndrome, which is something very rare. I've seen it once as a doctor. However, this leads to increasing paralysis and often requires ventilation. And the causes are often very difficult to identify. There seems to be an epidemic in Gaza of this condition, Guillain-Barré, and it may be triggered by infections. It may be triggered by other things, and in fact, it's been slightly sinister. Some of the doctors who are working in Gaza have tried to take soil samples away from Gaza, and they've been restricted from doing so. So I don't know what's causing this, but it's a very acute problem. Guillain-Barré, and it can have very serious repercussions as well. So, on top of all this, we are now facing this even more alarming development, where 37 international NGOs, including Médecins Sans Frontières, are facing deregulation on the 1st of March. That's next week, everyone. And if this proceeds, they'll be no longer able to legally operate in Gaza, the West Bank, or even East Jerusalem. Now, MSF alone support 1 in 5 hospital beds in Gaza and assist in 1 in 3 births. And in 2025, it performed 22,000 surgical operations, handled over 100,000 trauma cases, and carried out over 800,000 outpatient consultations. If these organisations are forced out, then the consequences will be catastrophic. So, I asked the Minister, would he urge Israeli officials to reopen humanitarian medical corridor, allowing critically ill patients to travel to East Jerusalem and the West Bank for treatment? The World Health Organization holds a list of approximately 18,000 urgent cases, yet permission to travel this short distance for care has been routinely denied, and that includes urgent cancer care as well. And will he use any possible leverage we have to ensure that the Israeli government also immediately pauses this deregistration of international humanitarian aid and negotiates their continued presence in Gaza? I think, as the Honourable Gentleman mentioned, we need to establish a medical supply chain which allows medicine and equipment into Gaza as well, immediately. And we need to find rapid alternatives to destroyed facilities. Now, I do know that, for example, there are mobile operating theatres that could be in Gaza within 48 hours, about the size of articulated lorries that could be driven in, and they're self-maintaining things. We could be operating with those almost immediately, and that's something that we must push to allow into Gaza. And also, we need to start rebuilding hospitals and also build up field hospitals as well. So there is a lot to do, but we must start on this process. And finally, will he work with our allies to ensure that the attacks on healthcare are investigated and documented and prosecuted wherever they occur? Healthicide must become a recognised and exposed, and we must deter it in the world. So, one of my questions: how I was refused entry into the West Bank last year, and I realised that it's very difficult to get any leverage over the Israeli government to influence their decisions, and I do respect that, and I understand that the Foreign Office try what they can, but is it time that we actually impose proper full sanctions on Israel if this doesn't resolve itself? So I'd like the Minister, I'd like to hear his opinion on that. So to conclude, healthcare workers in Gaza are performing the most difficult and courageous work imaginable under often literal fire. They deserve protection, and their patients deserve care. So we cannot simply look away, and we need action now.